Hello and welcome to At the Heart of Health with Dr. James Markham. In today's well-marketed world, it's hard to know who or even what to believe when it comes to health care. In each program, Dr. Markham, a board-certified behavioral cardiologist, takes a balanced approach using common sense modern medicine and the ultimate source of truth, the Bible, recognizing that at the heart of health is love.
I'm Dr. James Markham, and welcome to Heart of Health. Each week we bring healers from all walks of life into your home. We answer your questions that come into our website, which is heartwiseministries.org. Last week we talked about adjusting the body, changing your chemistry via chiropractic care. And we had Dr. Morris with us, and we had such a great response, and so many more questions came in. We're going to continue some of the same discussions and some of the same learning curve that we had last week. Lisa, we have a whole new audience this week, so tell us, how did you get involved in this healing message? What brought you into the chiropractic care?
Well, Jim, thanks for having me back.
You're welcome.
What brought me into care was my need of chiropractic care to begin with. I was in a very traumatic accident, and due to that accident, I was brought to the needs of a healing touch. I was brought to the hands of a chiropractor, and he was able to correct my subluxations, which is nerve interference.
Now, how old were you when all this happened?
19.
Now, what did you think, 19-year-old, what did you think about you would be doing with your life? I mean, did you have any thoughts, or this, did you have any preconceived plans, or you just, boom, you just end up saying, this is where I should be?
Actually, I was going to be a forensics doctor.
A forensics? Oh, wow, that's
Yes.
very interesting.
Yes,
Now,
my major.
where did you live at this time? Were you in the Tennessee area, or?
Athens, Tennessee.
Athens, Tennessee. Well, I know what that is. It's not too far from where we're at right now in our studio. So a chiropractor, did you have to go to school for this, or?
Yes, after your bachelor's degree of 4 years, then you have a remaining approximate 4 years at a chiropractic school, and I went to Life College in Marietta, Georgia.
Now, what are some of the classes that you might take in chiropractic school?
Oh, wow. Well, starting out, you take all the classes that you would take in medical school for the first half of the school. You take the same boards and all those exams. And then the second half of the school, they really train you more on the neurology part. You have, of course, A&P. You have, wow.
So you have anatomy, physiology.
Of course.
And all the same courses that anyone takes. And now the second part of is that when you practice on patients, or?
That's when we are allowed to put hands-on to patients.
Okay.
And we start with students, of course, before we're released to the public. And we have a lot of technique classes at that point. There are a lot of different techniques. Everybody has their own touch, and you have to find what's right for you. I would adjust a newborn baby differently than I would adjust you, Jim.
This is very interesting because, if I was out there, we're going to talk about during the program about what chiropractic care is, but it sounds like I wouldn't want to see someone that's been doing this for a few years. I mean, because haven't you learned through the years become better and better?
You have more experience. Granted, when you graduate, you have plenty of experience. You've got about 2 years experience when you graduate. And then you just have more knowledge of what to expect. The thing with chiropractic adjustments is the speed and the thrust.
Now, in part one, we talked about these neurotransmitters. We talked about these signals of electricity. And so overview, when you do a subluxation, what are you trying to do with the nerves exactly?
We're trying to make it happy.
A happy nerve.
A happy nerve. The best way I explain this to people is a nerve generally will look like a piece of thread. when it gets angry, when it's impinged, it can look like a piece of red licorice.
Wow. Now, have you actually, do they do it in your school when we see these nerves? I mean, you can't.
No, Jim, I've never actually seen one look like a red licorice. But trust me, if you're being carried into the office, you would say that it feels like a red licorice stick.
Lisa, we've collected questions from all over the world, and we're going to answer them after we come back from our break. And listener or viewer, if you have questions, you can get a hold of us at our website at heartwiseministries.org. Stay with us. We'll be back after this brief break. I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You can easily spend $90 on an expensive meal out. How about investing $89.94 in your future? Just think about the possibility of coming off those prescription pills and getting rid of all the side effects. Think about feeling better than you have ever felt in your life. This is all possible for you. For only $89.94, you will receive a 7-part DVD series, Weight Management by the Book, a 30-lesson workbook with over 100 recipes, and if ordered today, exercise tubes will be included for free to help with your journey. There are many programs available, but this unique program has identified the truth about how to manage weight. This program is not available in stores. This limited offer will not last long. Pick up the phone now and dial 877-504-9628. Operators are standing by. This call will change your life forever.
Two words for you. Pop quiz. Ready? Name any funny movie. A drama. Name a mystery. And one more thing. Name the movie your kids saw today in science class.
Know what really matters. Know about your kid's school. And know about your kid. Find out 100 ways to know more, do more.
Welcome back to Heart of Health. Lisa Morris has graciously joined us. She's a healer that works in the chiropractic arena. And Lisa, the story you had, I heard of a story where, you got hurt. That's what sort of brought you through. I heard earlier that you went through a sunroof. Can you tell our listeners about exactly what happened?
Well, I was young. I knew it all. I was going too fast, and I flipped and hit a tree. Now, the story with the sunroof is, this is just God working. This is God, wow, I just love it. But I had asked my father for almost an entire year to have a sunroof cut into the top of my car, and he had denied it. And then all of a sudden one day he said yes.
It's out of nowhere.
Just out of nowhere. He said yes. And we took it the next day, had it put in, and I had my car back about 2 days, and I had my accident. And my head went through the sunroof, and the car just caved in around my neck, and I was hanging upside down.
Upside down.
Upside down.
And then that sort of led you on this journey through your chiropractic care. How did that chiropractor help you in your healing process?
Actually, Jim, I was working one day, and I could not sit up for more than 15 minutes at a time without having to lay down on the floor on my back. And my employer said, "Why don't you go see a chiropractor?" And I said, "A what?" She said, "A chiropractor." And I said, "Well, what's that?" And she said, "Well, he'll do something with your back to make you feel better." And that's all I knew. And I went, and after my first treatment, I felt so much better. And I said, wow, this is definitely something that I want to look into.
Now, the word subluxation comes up, an adjustment. Talk to us again about what's an adjustment exactly.
An adjustment is a specific line of force. It's a thrust that is through our hands to the patient, to the subluxation. A subluxation is nerve interference. It is where a trauma has gone into the body, a stress has gone into the body, and it has moved the bones around, and it has put pressure on a nerve. It's kind of like squeezing a straw.
Right.
And we need to remove that interference in order for the function to remain in the body.
Well, that's neat because, you know, we talk about all these neurotransmitters and how the nerves talk, and I guess a nerve can be unhappy if it's squished.
Exactly.
I would be unhappy if I was squished too. So they do these adjustments by these pressures, and that sort of makes the nerve happy, so the normal flow of chemicals is normal? Is that what happens?
Yes, and only a small percentage of a nerve has pain fibers. I think it's 11% of the nerve has pain fibers.
Okay.
The 89% of the nerve is what's controlling the body. You've got the autonomic response, and you've got the muscular response. And so you don't have pain. You can have nerve compression, severe nerve compression, and never have a pain. If that nerve compression is going to your heart, for example, your heart is going to become weakened. It's going to become in a state of disease or a state of disease. You have heart disease, heart disease, heart disease, you have a heart attack. At what point do most people start addressing the problem?
Right.
When they have the symptom.
Now, I've seen a lot of patients that have different types of nerve problems from diabetes. Does chiropractic care, can they help with that kind of, you know, like diabetes, it damages the nerves, or they have a vitamin deficiency like folic acid or B12 deficiencies?
Most definitely. The nerves in your body, when they leave the brain, they put function into every single tissue and cell in the body. Organs are affected. Everything is affected. Jim, we see people in our office all the time with diabetes, and then miraculously, their body's producing insulin again.
Wow. That is. So chiropractors work a lot on changing the chemistry, maybe not with pills, but they change it by aligning things up the way God would want it to be.
Exactly.
And correcting the normal chemical balance. So you sort of get things back to normal.
Exactly, but it's not, I'm not saying that we're going to cure.
Right.
We don't cure, we don't treat disease of any kind. All we do is put the power back into the body.
Right. Now, when you do this, I'm sort of curious about how would you know? There's so many different healers out there, even in the medical profession. You know, this doctor does this way, this doctor does the other way. How do you know which chiropractor to choose? You know, some use different techniques. How do you know who's good and who's bad? And you know, how do you know that? Word of mouth or
a
results?
lot of it is word of mouth referrals. If your patients are happy, they are going to refer people to you, and there are different chiropractors for different types of people.
Now, so you wouldn't advise just going to the phone book?
Well, it's a good place to start. For example, if you're looking for a chiropractor for your entire family, as a primary physician for the entire family and the children, you're looking more for a family chiropractor.
Okay.
You're not looking for more of a pain chiropractor. There are chiropractors that work with pain, and that's what they're really good at. There's chiropractors that work with wellness, and that's what they're really good at.
So you choose based on what problem you think you need to work at. Now, are you trained in all these areas, or just this becomes expertise as you move on?
We all have the same training. It's just the passion of the doctor.
And now, what do you specialize in?
Well, I specialize in the wellness. I specialize in families, and my husband is also a chiropractor, and we are both board certified in children. And so we have gone that extra mile to specialize in children. And we will see babies the day they're born. Jim, I must share this with you. I have been at 2 home births, well, medical or hospital births also, but 2 births where the baby has come out in distress and was not breathing. And in both cases, I went up, I adjusted the upper neck of the baby, and in both cases, the baby began to breathe.
Wow, that's incredible.
It's incredible to see the first breath of life, especially if that baby was going to be struggling.
This is fascinating.
It is.
Well, we're going to break right now. We're going to come back and talk. We didn't answer very many questions that segment, but we're going to come back in just a second and answer some of the questions you've sent in with Dr. Lisa Morris. We'll be right back after this short break.